Hey, this is Dr. Ryan with the Chiropractic Spa coming at you with more knowledge bombs today. Today we are talking about golfer's elbow, something we see all the time here in Southern Florida because guess what? Golf season's year round. So we're going to talk a little bit about that. In our world, we call it medial epicondylitis. Another one of those Scrabble words. Just don't play me in Scrabble because we got all the Latin words and you're going to lose. So we're going to talk about this. All it is tendonitis of the medial aspect of the elbow or the inside aspect of the elbow. Because remember, in anatomical position, our body is like this. So this is the middle side or close to the midline. So we have tendons that run down the length of this forearm here that flex the wrist. And when we overflex the wrist, we tend to use these muscles a lot more, which gives us that medial epicondylitis. So we're going to give you a few tools to combat that. So for this one, I use my thumb almost exclusively. So you're going to find that tender spot and you're going to pinpoint it. So you just start on this medial epicondyle and you're just going to kind of work your way down that ridge of the forearm. You're going to find that tender spot, like I found one right there, and you're going to start with your wrist flexed and we're just going to extend out like that. Gonna be pretty tender, but you gotta crack a few eggs if you're gonna make an omelet. So you really gotta get there and dig in and open it up. And you can even flex and close the hand. You can see how my thumb is moving. My thumb is moving under the pressure of those tendons. That's really opening up. Oh, I found one. That's really opening up that tendon and really allowing that to relax in there. So a few things for you to do. Definitely start with that. Give that pin and stretch a good try. Definitely ice. Ice is going to be your best friend in this area. And then we have 3 great tools here in the office, in the clinic, to help you get back on your feet sooner, so you're back in the golf game and you can beat your buddies in your scramble game later on in the afternoon. So definitely ice it. I do 20 minutes on, 20 minutes off. When you come to the office, we're going to inspect your shoulder. We're going to inspect your upper back, because if we don't get thoracic extension, guess what? The elbow has to actually extend for us. So, especially for pitching motion or anything like that. So we want to make sure that your thoracic spine is moving, your shoulder is moving, or your wrist is moving. Because in actuality, the elbow is kind of stupid. It's really only supposed to do this. There are a few other motions, I'm simplifying, but it's really dumb. The wrist, however, does this, and the shoulder does a whole bunch of movements. So we want to make sure everything's lined up for you and grooving how it should. Then we can also cup this area. Cupping is great for pulling that inflammation right out of that joint. Then we can do some dry needling and some instrument-assisted soft tissue mobilization. And we can even do some acupuncture on the area and for the joint. Been very successful at reducing pain in the elbow through acupuncture and a systemic approach to treating your golfer's elbow. Because sometimes it's not just the elbow, it's a whole system thing. So give us the chance to help you out, and we look forward to seeing you soon.